welcome. I am Terry DeShanes-Lamb with the Healthcare Partnerships team at MDA. Thank you for joining us today for the MDA Industry Update webinar presented by Mitsubishi Tanabe Pharma America. MDA's Community Industry Update webinars are programs which provide an opportunity for the community to receive information and updates impacting care and treatment directly from pharmaceutical, biotechnology, and medical equipment companies. These webinars are just a part of MDA's community education program. We encourage you to visit the community education pages of MDA.org. You will find an abundance of resources, informative recorded webinars, and listings for upcoming educational events. Of course, if you have any questions or need assistance, the MDA Resource Center is available to you by email at resourcecenter@mdausa.org or calling 1-833-ASK-MDA1, or you can reach the Resource Center on mda.org. At the end of this webinar, you will receive a survey link. Please take the time to complete this short survey so that your voice is heard and you can help us create more impactful programming for future events. Additionally, you'll be provided with links and resource information by Mitsubishi Tanabe Pharma America. This presentation will also be uploaded for on-demand viewing within the next few weeks. Now, I will be sharing a pre-recorded video with Tara Charlton, an ALS Clinical Coordinator. Thank you again and enjoy this impactful presentation.
This video is sponsored by Mitsubishi Tanabe Pharma America Inc., MTPA. The speaker is presenting on behalf of and has received compensation from MTPA. The content in this video is not a substitute for independent clinical assessment or judgment.
Hello, I'm Tara Charlton. I'm a clinic coordinator in an ALS center for several years now as a part of a multidisciplinary team who tends to the needs of the people we treat. In this video, I am not here to give medical advice. I'm providing an example of my own experience in an ALS clinic. Your doctor is the best source of information about your treatment plan, including where and from whom you will receive treatment. When your doctor prescribes RADICAVA ORS or edaravone for you, my role is to make sure that you know your options regarding access to treatment. I also coordinate your personalized care with a team of specialists you will meet, such as a physical or occupational therapist, speech pathologist, respiratory therapist, and nutritionist. These specialists complement the care provided by your doctor. I see people with ALS and their families who are often overwhelmed when they come into the clinic, so I make sure to provide support for their questions and concerns and help them navigate the care they need. One thing to note is that ALS clinics vary. Some are large with many more specialists and resources, while others are smaller with less staff, so they may not necessarily have a clinic coordinator like me. But this does not mean you're not getting quality care. They just work differently. Before your first visit to an ALS clinic, make sure to have all the documents you need for your RADICAVA ORS prescription. This helps with getting your prescription filled and your medication delivered to you as soon as possible. You should bring the patient authorization form or the benefit investigation and enrollment form, or BIF, which should have been completed by your doctor. If you don't have these forms, don't worry. Your doctor's office can provide one for you. You should also bring your insurance cards, either a private insurance card or a federal insurance card, as well as a form of ID like a driver's license. With these documents in hand, we can start processing your prescription and help evaluate or determine your treatment coverage. Not having these documents or having incomplete information in your patient authorization form or BIF can hold up processing your prescription and potentially delay treatment. If you have any questions or concerns, call the clinic in advance to prepare you for your first visit. Also, it can be helpful to prepare a list of questions you have for your doctor. When you arrive at the clinic, we'll register you and review the forms and documents you bring with you. We start processing your prescription at your visit because it may take anywhere between a couple of days and a few weeks before you receive your medication, depending on the type of insurance you have. What this means is that your prescription has to first go through your insurance to make sure it's covered, then through a specialty pharmacy, a type of pharmacy that focuses on medicines for patients with complex disease states. You may keep in touch with your doctor's office or call the specialty pharmacy to get updates about your medication. While you're waiting, continue taking your current medication as prescribed by your doctor until you receive your new medication. You can also continue learning more about ALS and your treatment. You may also contact the JourneyMate Support Program, a program to supplement the RADICAVA ORS resources that your doctor provides. Experienced program team members are trained to address your RADICAVA ORS educational needs and provide you with personalized answers and resources. At your first visit, you will also meet your ALS doctor and nurse practitioner who oversee your team. They will talk to you about your ALS diagnosis and provide you with a unique care plan. You'll have appointments in the coming weeks with various ALS specialists who will help you manage your day-to-day symptoms and suggest ways your caregiver can assist you. Ask your caregiver to set up a calendar, noting your appointments and your treatment schedule for the days you'll be taking RADICAVA ORS. This calendar will help you keep organized and on track with treatment. Due to certain circumstances, an ALS clinic may be closed for in-person appointments, but they may offer telehealth through the phone or online. Check with your ALS clinic to see if they are permitting in-person visits. You may be a little hesitant or frustrated with the concept of telehealth, but we make sure that your questions and concerns are answered and that your team provides you with the best virtual healthcare experience. It may feel overwhelming and confusing to figure out your financial assistance options for your treatment, but don't worry, we're here to help. The first thing we do is determine your insurance coverage and the financial options that may be available to you that would help cover out-of-pocket costs for both your medication and other aspects of care, such as assistive equipment. From October 15th through December 7th each year, you can join, switch, or drop a plan. If you have a high copay, contact your specialty pharmacy. They can look into additional financial support for your medication. Depending on where you live, there may be different options available to you. If you're a veteran with ALS, the VA offers financial and medical support. RADICAVA ORS is on the VA National Formulary. The VA also has ALS treatment centers of excellence throughout the country. These ALS clinics have a high standard of patient health care. Contact the VA to find out if a center is located near you. If you have private or commercial insurance, you may be eligible for the out-of-pocket assistance program for RADICAVA ORS from the drug manufacturer. The RADICAVA ORS out-of-pocket assistance program allows eligible, commercially insured patients to pay as little as $0 per prescription, subject to an annual maximum, as well as other terms and conditions. You can find more information on radicava.com. The JourneyMate Support Program is also available to those with a RADICAVA ORS prescription, which includes an insurance and access specialist who can help you understand insurance coverage, financial support options, specialty pharmacy options, and the steps to accessing your RADICAVA ORS prescription. You may also ask your specialty pharmacy to help you apply for the out-of-pocket assistance program. Don't be concerned or surprised if you are contacted by a different pharmacy, because that's just how the prescription is processed. If you are currently receiving RADICAVA IV and you and your doctor have decided together that you're ready to switch to RADICAVA ORS, consider talking to someone like me at the ALS Clinic, or contact an insurance and access specialist to help you determine your insurance coverage for RADICAVA ORS. If you are denied coverage, let your doctor know. You may be able to appeal your insurance company's decision. Also, there are advocacy organizations that may be able to help you find additional resources. For patients without insurance and who meet the eligibility criteria, including the household income criteria, may qualify for the Patient Assistance Program for RADICAVA ORS, which provides medication at no cost to you for 1 year. Before I give you my final thoughts, here's the important safety information for RADICAVA ORS.
RADICAVA edaravone and RADICAVA ORS edaravone are indicated for the treatment of amyotrophic lateral sclerosis, ALS. Do not receive RADICAVA or RADICAVA ORS if you are allergic to edaravone or any of the ingredients in RADICAVA and RADICAVA ORS. Before you take RADICAVA or RADICAVA ORS, tell your healthcare provider about all of your medical conditions, including if you have asthma, are allergic to other medicines, are pregnant or plan to become pregnant. It is not known if RADICAVA or RADICAVA ORS will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if RADICAVA or RADICAVA ORS passes into your breast milk. You and your healthcare provider should decide if you will receive RADICAVA or RADICAVA ORS or breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of RADICAVA and RADICAVA ORS? RADICAVA and RADICAVA ORS may cause serious side effects, including hypersensitivity, allergic reactions, and sulfite allergic reactions. Hypersensitivity reactions have happened in people receiving RADICAVA or taking RADICAVA ORS and can happen after your medicine has been given. RADICAVA and RADICAVA ORS contain sodium bisulfite, a sulfite that may cause a type of allergic reaction that can be serious and life-threatening. Sodium bisulfite can also cause less severe asthma episodes in certain people. Sulfite sensitivity can happen more often in people who have asthma than in people who do not have asthma. Tell your healthcare provider right away or go to the nearest emergency room if you have any of the following symptoms: hives, swelling of the lips, tongue, or face, fainting, breathing problems, wheezing, trouble swallowing, dizziness, itching, or an asthma attack in people with asthma. Your healthcare provider will monitor you during treatment to watch for signs and symptoms of all the serious side effects and allergic reactions. The most common side effects include bruising, contusion, problems walking, gait disturbance, and headache. These are not all the possible side effects of RADICAVA or RADICAVA ORS. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to www.fda.gov/medwatch or Mitsubishi Tanabe Pharma America Inc. at 1-888-292-0058. Please see full prescribing information and patient information on RADICAVAORS.com.
Keep up with your scheduled ALS clinic appointments so we can track your progress, help you stay on your treatment schedule, and ensure you continue to receive care from your multidisciplinary team. Knowing the financial options for your treatment and other types of care you need can feel overwhelming, but I can help you figure out your options as well as put you in touch with other financial specialists or organizations who can help. Remember to remain patient while your prescription is processing and empower yourself by learning more about your disease and treatment. You may contact the JourneyMate Support Program to learn more about ALS and your financial support options. Thank you so much for joining us today. I hope you found this information helpful. And do not hesitate to reach out to your ALS clinic, physician, or JourneyMate Support Program for additional information or support.
We hope you enjoyed this presentation. Please be on the lookout for a registration invite in your email for our next presentation in this series, a personal experience with a family member of a loved one with ALS. Additionally, you will be provided with links and resource information by Mitsubishi Tanabe Pharma America in a follow-up email. Thank you again.